Diabetes is a huge public health problem. It's impacting the lives of millions of people in Europe at the moment, and it's also still expecting to rise. There has actually been a lot of research on coffee and type 2 diabetes risk, and it's well established that a moderate consumption of coffee can lower your risk of developing type 2 diabetes. But the mechanisms on how this works, they're not well understood. We used data from two very large cohort studies, so cohorts in the general population, one in the UK and in the Netherlands. And we first explored whether also in these cohort studies coffee intake was associated with lower type 2 diabetes risk. And then we further explored potential mechanisms, and we hypothesized that inflammation status of the body may partly explain these beneficial effects. We first confirmed evidence from previous studies. We also saw that a higher habitual coffee consumption was associated with a lower risk of type 2 diabetes. And we also saw that a higher coffee intake was also associated with lower insulin resistance. It's a lower, earlier phase of diabetes. And then what was new in our study, we saw that there's also differences in levels of various inflammatory markers. So we saw lower c-reactive protein levels and leptin concentrations, but also higher adiponectin and interleukin-13 levels. These inflammatory markers partly explain the association that we observed for higher coffee intake and lower risk of type 2 diabetes. In our study population, we indeed confirmed that a higher coffee consumption was associated with a lower risk of type 2 diabetes. We saw that each one additional cup per day was associated with a 4 to 6% lower risk of developing diabetes. And experts consider 3 to 5 cups of coffee per day as a moderate and safe amount. There are some differences for different types of coffee, and the strongest effects were observed for filtered and espresso coffee. Findings of our study can be important because, well, of course, type 2 diabetes is a huge public health problem, and we know that a healthy lifestyle and a healthy diet can help prevent the disease. And our findings suggest that moderate coffee consumption can be a part of a healthy dietary pattern, actually lowering your risk of type 2 diabetes. So people can enjoy drinking their coffee as part of a healthy dietary pattern